Uh, uh,
Let me go get a stool.
uh, Nurse blew my veins at the HCA. Emergency room here in Tallahassee. Right there. And right here. Oh no. I had to put the IV on this arm. Right here. Oh god. And my stomach was pulsating right here about a minute ago. Oh god. Oh, the nurse had a difficult time on this side. To see the discoloration there.
Right here?
Yeah, and then out there to the left, about a couple inches left on the left. She had accidentally blew the vein. She had to put the IV on the left arm. I don't know if you could put it on my wrist, maybe, or something.
I'm gonna look and see.
Thank you, ma'am.
Pump your fist like this. Yep, thank you. That's okay, I'm here.
Feels numb. I think it might have been from donating plasma.
Okay, just hold your fist tight.
Okay.
Hold your fist tight.
Thank you, ma'am. Don't push it any further, please. You don't need to push it any further.
Dude.
Okay. No, I'm just saying because I saw the blood go all the way through. So it's...
No. I'm the nurse. Are you?
Well, I thought.
Okay. No.
I'm sorry.
Okay. But this is the safest for you. Otherwise, if it's not in there all the way, it can blow the vein. And I don't want that. I want you to get your medicine.
Yeah, but usually when the blood goes through to the end, that means
It's in the vein, but it's not all the way in.
Yeah, but
Okay.
if the blood's
You
going
know, what do you do for a living?
to be honest with you, more than I'm doing now, and I want to do more than I'm able to do now.
What are you doing for a living?
I volunteer for the White House,
Okay.
but I'm only telling you that from experience. That's what I was saying.
I know, but nobody likes to be told how to do their job when they've been doing it 30 years.
Yeah, of course not. I wouldn't want somebody to tell me how to.
Especially when I'm trying to help you here.
Yeah. No, I'm not trying to tell you how to do your job. It's just, it's really painful when they push the needle further in, especially after the blood is already pumping all the way to the IV.
I got you. Okay. We'll just agree to disagree. I am giving you Decadron. It is a steroid, anti-inflammatory. It is given for inflammation, and pain. Okay?
Okay.
Okay.
It's just usually when I feel that pain from when the needle goes all the way through, it's always a big bruise that's left there, similar to when the other nurse was trying to put the IV in. The same thing. She pushed the needle all the way in, like really far in, and started hurting really bad, and it left a really big bruise. But I also think I made her nervous because I told her she looks like a delicate flower, and because how petite her wrists are, and I also told her she looks like Rihanna, and she said, "Thank you," and she said nobody's ever told her that before. So I don't know, maybe that's why she pushed the needle all the way in. But she seemed like she appreciated the comment. I mean, but then she had to send another nurse to put the IV in my left arm, and she was able to put it in right away. I didn't feel any pain on the left side.
Oh, good. This is a flush.
She said she's gonna have to send in the reinforcements to put the IV in the left arm, and she said they have more experience with doing the IV, so she sent another nurse in there, and then she put the IV in the left arm.
That happens sometimes. All right. This one is the Toradol. It's an anti-inflammatory, non-steroidal pain medication.
Thank you, ma'am. Yeah, they gave me the Toradol last time. The pain went from like a 11, like a scale out of 1 to 10. It went from like an 11 to maybe like a 5 for about 20 minutes. But then the pain came right back. Then they had to give me a pill that was supposed to help with pain also. And then after they gave me the pill, they discharged me. So I don't know, maybe if you could tell them what happened last time, so I'm not in so much pain.
Okay.
Because they gave me that pill after like, I think more than an hour or 2 hours after the Toradol wore off. And I was in a lot of pain.
Okay.
How many times do they have to flush it?
Before, between, and after every medication.
Before, between, and after. And if I taste it, that means it's flushing through the vein properly?
That is correct. Now, I need to update your medical file. Do you have any health problems?
I don't know, but I don't taste the same.
Not everybody tastes it.
Okay.
Do you have any health problems that you've been diagnosed with?
I don't know.
Okay, then do you take any medicines routinely for anything?
So I just finished the, what is it called? An antibiotic?
Any medications that you take routinely, like regular, not like an antibiotic that you would just take for a while?
I've been taking I finished the doxycycline hyclate 2 days ago. I've been taking,
How long have you been?
diclofenac SOD. And I took ondansetron. It's called diclofenac SOD, ondansetron, and a methocarbamol. So I took the diclofenac SOD every day for the past several days since I received it from my primary care physician. And I also been taking the ondansetron because the pain is in my stomach also. And then also been taking
Are you recording?
Yeah, I have to for my safety. I can send you the video.
Well, you shouldn't record without asking the person you're recording.
Yeah, but it's beyond that. So
Well, you know, I believe it's a hospital policy.
tell them to take it to court. It'll help me.
That's not the way to be.
Yeah, but I need them to acknowledge things that are necessary, and they're purposely not acknowledging it. So me recording myself for my safety, it'll force them to acknowledge things that I need them to acknowledge. And I'll fill you in on it. What I've been doing also, instead of sending my complaints and discharge documentation and doctor's appointments and medication that I'm prescribed and everything individually on emails to my opposing counsels and doctor's offices and several participating government
Let's
agencies.
put this on your non-IV arm. Here, I'm gonna put this down because it's too bunched up to
So
get a good one.
instead
for
of
blood
sending
pressure.
them those emails separately, I've sent all that information on one email thread with all of them on the same email thread. So they all have no choice but to acknowledge it all at the same time. Because what they were doing previously was they were acting like they weren't receiving the emails and they weren't receiving my complaints, documentation of my doctor's appointments and discharge documentation. So I had to kind of be tactical about it because I noticed they were also unethically
Miss,
hacking.
your ID band, please.
I noticed also they were unethically hacking my phone while they were doing all those things. So from experience since 2015, since they killed my son at HCA Northwest Medical Center in Margate, Florida,
I'm sorry to hear about that.
thank you for your concern. And my son's mother was in the military, sued them and won $5 million. They've been unethically hacking my phone, maliciously harassing me, and then 4 police brutality cases happened after that that injured me. So I had to move to Tallahassee, Florida for my safety from South Florida. And I've been documenting it every step of the way because they shut down the courthouse and they shut down the government when I tried to sue for the first 2 police brutality cases in the city of Miami in 2018. And then they said it's a coronavirus pandemic. And then they said I exhausted the statute of limitations while everybody was on lockdown during the pandemic and while they kept announcing different variations of the coronavirus and putting people on lockdown and taking them back off lockdown. And I told them that the statute of limitations expired for no fault of my own. They shut down the government, they shut down the courthouse, and they said it was a coronavirus pandemic. So then they said I have to present, Trayton, good to see you again. Then they said I have to present the case.
Come back in a second?
No, he's ready to go to CT.
Okay, perfect.
And they said I have to present the case through something called equitable tolling, an equitable tolling remedy, which removes statutes of limitations. So I had to file a petition, but I had to appoint my father as my guardian to do that because I'm legally, physically, and mentally incapacitated, and I'm traumatized because of it. So I can't
Well,
continue.
sir, Mr. Floyd, I'm sorry to hear all that happened to you, but I do not appreciate being videoed without my consent. And
I'll be honest with you, Stacy. I don't even appreciate having to videotape me and you
And I
or
do-
Trayton or anybody because I'm in more pain having to hold my phone, literally. But at the same time, if you would like to, we could take it to court because that would help me. And when I win, I'll give you some of the money.
I am not interested in court. I'm just interested in doing my job.
That's great. And you'll probably get a raise because I guarantee you, when I finally am able to present the evidence to the judge and I win, everybody who helped me, directly and indirectly, I'm gonna take it upon myself to compensate them.
Mr. Floyd, I'll see you in a little bit. He's going to take you to CT, okay?
Yes, sir. And as you probably saw, my name's Trayton, and I'm going to take you upstairs in the bed to CT.
Yeah, I remember you from the previous video that I made in the CT scan.
Oh, yes, sir?
Yeah. You got good aim. When I handed you the papers that were in my pocket, you kind of tossed them on the bed, and it landed literally just right out of the camera's view on my phone. So I was able to capture the CT scan still.
Oh, yes, sir?
So-
Perfect.
Yeah. I mean, it covered it a little bit, but it was still visible, so that was good.
Okay. Let me just move the bed this way a little bit so I can open the door.
Oh.
All right. Before we get too far, can I get your first and your last name?
Yeah, absolutely. I'll do one better for you. There's my ID band there for you.
Look here. Thank you, sir.
Mm-hmm. Oh, God. Oh, my God.
Once we get upstairs, these scans shouldn't take any more than just a couple of minutes once we get it going.
Alrighty. Oh, God. Oh, God. Oh, God.
Sorry.
Oh, God.
And this road here on the right.
Nice.
Just a second, and we'll get started.
Thank you, Trayton.
Yes, sir.
Oh, God. The pain came back on my left side. Oh, God. Oh,
Are you able to stand at all, sir? Or
yeah, I could do backflips. It's just I'm in pain. Oh, God.
All right, so we're
It'll be
gonna
easy to
let the
slide.
rail down, and your head's gonna go up here on this pillow.
Okay. Oh,
help you if you need it.
oh my God. Bismillahirrahmanirrahim. Oh, God.
And then don't try to stand all the way up. If it hurts too bad, just kind of swivel to this side over here.
Okay. Oh. How'd I do this last time? Oh.
Do you have anything in your pocket?
No, ma'am.
No. Put your head on this pillow up top.
Oh.
And you do have a little metal thing right there, so I'm gonna give you a cover so you can pull it down.
Okay.
You want a sponge underneath your knees?
Yes.
Get you the bigger one.
Thank you, Trey. I need one of those for my house.
Alright, I'm gonna give you this. I want you to just pull them down right closer to your knees, okay?
I was actually gonna recommend. Oh. Oh. It hurts right here on
Right
the
there.
left side.
Alright, let's go ahead and get a quick picture of it, okay? This is a real quick exam, okay?
The pain is in my left testicle,
Uh-huh.
and in my left testicle area,
Mm-hmm.
and then it's going up to my left side of my stomach, and then it's going to my left hip, and then it's going to my left lower back, and then it's going to my left upper thigh, and it's going to the middle of my left thigh, and it's going down my left thigh, and then the top right here of my left thigh is low.
Alright, so what we're gonna do, we're getting a picture of like your back all the way to your testicle, and then you'll get a ultrasound of your testicles, okay?
And my hands and arms and my legs and feet keep going up. And the back of my neck is hurting also.
Okay. So let's get a quick picture of it. I want you to take your arms, let it rest above your head for me.
Okay.
Yep, bend them behind your head. There you go. Alright, now all you have to do is hold really still. Alright, Here we go.
Alrighty, sir. You can go ahead and pull your pants back up. Any help? I'll get this sponge off me your leg, make it a little easier. Running from here so you're not tripping on it. Help. Here if you need anything. Do you want to take this blanket back with you to the room?
No.
Okay.
Thank you for your concern, though, Trey.
I'm going to take care of these and I'll bring you back.
All right.
Next to me in here. Just 1 second. bring you back.
Oh my God. Yeah, I know. It's for my safety.
You're not allowed to have it recording.
Huh?
You're not allowed to have it recording.
Yeah, I really don't want to have to do it either, but it's for my safety. I'm just recording me.
Okay. Security may have to come and get you to turn it off.
You know,
Unfortunately.
that'd be great if you could ask me to do that for me.
Okay.
Yeah, because at least they'll be able to acknowledge it on a,
Yeah.
a superior level.
Yeah.
Thank you so much.
Back to the room. Thank you.
I'm good. How about you? Thank you.
Okay.
What's that?
Sorry, actually, my bad. Room 5 and 7 look similar. We are in 5. Okay. I'm gonna just reconnect you to a couple of things, and I'll be out of here. All right?
Thank you, Trader.
Yes, sir. A couple of these things back on. You remember which finger this finger monitor was on?
I don't remember, but I don't think.
Which hand would you prefer, right or left?
I don't think it'll make a difference.
Yes, sir. Just reach across here and reconnect this blood pressure cuff here.
Okay.
Bring it over top of you. There we go. Alrighty. And would you like your remote?
You could, I guess, put it like right here on the side.
Yes, sir. And just weave it through the bed so it doesn't fall. There we go. Oh, thought I was gonna. There we go. Here you go.
Thank you for your concern, Traden.
You are welcome, sir. We're gonna go ahead and get those images sent off to the doctor, and I hope they can tell you what's going on. Hope you get feeling better.
Me too. Thank you for your concern.
You are welcome.
All right. Okay.
Hey, I'm with the security, buddy. I'm
How
gonna
are
have
you?
to ask you to stop filming, or I'm gonna have to ask you to leave the building.
All right.
So,
Thank you for doing your job, sir.
yes, sir. So, what do you want to do? You want to stop filming, or you want to leave?
Yeah, actually, encourage them to bring the security in here, so at least they
policy.
can. Yeah.
Hospital policy. There's no filming.
Right. But I actually encourage them to bring their security in
Well, I'm
here.
here now, buddy. So,
That's right.
what,
And
what can we work out?
from a good faith perspective, I initiated a good faith effort, and I encouraged them to get security, so at least they could acknowledge it from a superior perspective. Thank you for doing your job, Mr. Bryan.
Are you gonna cut that off?
Yeah, absolutely, absolutely, Mr. Bryan. And thank
Thank you.
you,
And what's your
thank you
name?
for your concern.
What's your name?
My name is Omar Mohsen Ibrahim Fuad.
All right, Mr. Omar. I appreciate it. I can't pronounce the rest of it. I'm
I
sorry.
appreciate you, Mr. Bryan.
All right, cut it off for me.
Hey, just because you said so.
Thank you.
All right now. Time now is 8:46 p.m. Today is December 17th, 2025. Oh. Oh, God. Assalamu alaikum wa rahmatullahi wa barakatuh.